What is allopathic medicine? Allopathic medicine is a term often used to refer to conventional or Western medicine, which is the dominant system of medical practice in most parts of the world. The term allopathic was coined by Samuel Hahnemann, the founder of homeopathy, to distinguish his approach from conventional medicine. Allopathic medicine is based on the principles of evidence-based medicine and scientific research. It focuses on diagnosing and treating diseases using therapies that are supported by scientific evidence and have undergone rigorous testing, such as pharmaceutical drugs, surgery, radiation therapy, and other interventions. Allopathic medicine typically aims to alleviate symptoms, cure diseases, or manage conditions through interventions that target the specific disease or its underlying causes. Practitioners of allopathic medicine, such as medical doctors, MDs, undergo extensive education and training, including medical school and residency programs, to acquire the necessary knowledge and skills to diagnose and treat a wide range of medical conditions. They often use a combination of clinical examination, laboratory tests, medical imaging, and other diagnostic tools to assess a patient's health and develop treatment plans. Allopathic medicine is characterized by a reductionist approach, where diseases are often viewed as separate entities that need to be treated individually. This approach is in contrast to more holistic or alternative medical systems that emphasize the interconnectedness of the body, mind, and spirit. It's important to note that the term allopathic medicine is not commonly used within the medical profession itself, but rather as a way to distinguish conventional medicine from other medical approaches, such as homeopathy, naturopathy, or traditional Chinese medicine. History of Allopathy. The history of allopathic medicine, also known as conventional or Western medicine, spans centuries of developments in medical knowledge, practices, and institutions. Here is a detailed overview of the history of allopathy. Ancient and classical periods. Ancient Egyptian, Mesopotamian, and Indus Valley civilizations had medical practices based on observations, herbal remedies, and surgical procedures. In ancient Greece, renowned physicians like Hippocrates, often considered the father of medicine, emphasized observation, clinical examination, and natural explanations for diseases. Hippocratic medicine laid the foundation for a rational and scientific approach to medicine. Roman physicians like Galen expanded on Greek medical knowledge, emphasizing anatomy, physiology, and the use of medications. Medieval and Renaissance periods. During the Middle Ages, medical knowledge in Europe was largely based on ancient Greek and Roman texts, with limited advancements. The Renaissance period brought a renewed interest in scientific inquiry. Dissections, anatomical studies, and the development of medical universities contributed to the growth of medical knowledge. Emergence of scientific medicine. In the 17th and 18th centuries, significant advancements in scientific understanding and technology led to the emergence of modern scientific medicine. The development of the scientific method, advances in anatomy and physiology, and breakthroughs in medical instrumentation laid the groundwork for a more systematic and evidence-based approach to medicine. 19th century. The 19th century witnessed significant advancements in medical knowledge, clinical practice, and medical education. The discovery and understanding of microorganisms, such as bacteria, by scientists like Louis Pasteur and Robert Koch, laid the foundation for the field of microbiology and the understanding of infectious diseases. History of Allopathy. The history of allopathy, also known as conventional or Western medicine, can be traced back to ancient civilizations. Here is a detailed overview of its development over time. Ancient medicine. Ancient Egypt. The Egyptians had a sophisticated understanding of anatomy and practiced medicine as early as 2600 BCE. They documented their medical knowledge in papyri, including the Edwin Smith Papyrus, which described surgical treatments for various conditions. Ancient Greece. Greek physicians, notably Hippocrates, 460 to 370 BCE, emphasized the importance of observation, clinical examination, and the natural course of diseases. Hippocrates is often regarded as the father of medicine, and his teachings formed the basis of the Hippocratic school of medicine. Development of medical systems. Roman Empire. Roman medicine was heavily influenced by Greek teachings. The physician Galen, 129–216 CE, made significant contributions to anatomy and physiology. His writings, based on the humoral theory, dominated medical thinking for centuries. Islamic Golden Age. From the 8th to the 13th centuries, Islamic scholars translated and preserved ancient Greek texts, including those of Hippocrates, Galen, and others. Islamic physicians such as Avicenna, 980–1037, made important advancements in medical knowledge, including the Canon of Medicine, an influential medical encyclopedia. Renaissance. The revival of classical learning during the Renaissance led to the rediscovery of ancient medical texts. This period saw the emergence of human dissection and anatomical studies by figures like Andreas Vesalius, 1514–1564. The printing press enabled the wider dissemination of medical knowledge. Scientific revolution and modern medicine. 17th–18th centuries, the scientific revolution brought about a shift towards empirical observations and experimentation. Figures like William Harvey, 1578–1657, advanced understanding of circulation, and Antony van Leeuwenhoek, 1632–1723, developed the microscope, opening up new avenues for medical research. 19th century. Advancements in medical knowledge accelerated during this period. The discovery of anesthesia, by figures like Crawford Long, 1815–1878, and William Morton, 1819–1868, revolutionized surgical practice. Germ theory, proposed by Louis Pasteur, 1822–1895, and Robert Koch, 1843–1910, established the link between microorganisms and infectious diseases. 20th century. The 20th century witnessed remarkable progress in medical science. The development of antibiotics, such as penicillin, by Alexander Fleming, 1881–1955, transformed the treatment of bacterial infections. The introduction of vaccines and advancements in surgical techniques further improved patient care. Modern era. Evidence-based medicine. In the latter half of the 20th century, evidence-based medicine emerged as a cornerstone of medical practice. This approach emphasizes the use of scientific evidence, clinical trials, and systematic reviews to guide medical decision-making. Specialization and technological advances. Medicine became increasingly specialized, with physicians focusing on specific areas such as cardiology, neurology, or oncology. Technological advancements, such as medical imaging, minimally invasive surgeries, and the development of new drugs, further expanded diagnostic and treatment options. Today, allopathic medicine continues to evolve with ongoing research, technological advancements, and an increasing emphasis on personalized and integrative approaches to healthcare. It is worth noting that the development of allopathic medicine is just one aspect of the broader history of medical systems. Traditional healing practices from various cultures have their own rich histories and continue to coexist alongside allopathic medicine in many parts of the world. Current allopathic practices. Current allopathic practices, also known as conventional or Western medicine, encompass a wide range of diagnostic, therapeutic, and preventive approaches. Here is a detailed explanation of some key aspects of modern allopathic medicine. Diagnostic techniques. Clinical examination. Physicians perform thorough physical examinations to assess a patient's symptoms, vital signs, and overall health status. This may involve palpation, auscultation, percussion, and other techniques. Laboratory tests, blood tests, urine tests, imaging studies, such as X-rays, CT scans, MRI, and other diagnostic procedures help in assessing various aspects of health, including organ function, infection, hormonal levels, and genetic markers. Biopsy and histopathology. Tissue samples obtained through biopsies are examined under a microscope to diagnose diseases, determine the extent of cellular abnormalities, and guide treatment decisions. Treatment modalities. Pharmaceutical interventions. Allopathic medicine relies heavily on pharmaceutical drugs, including antibiotics, analgesics, antihypertensives, and more, to treat diseases and manage symptoms. These drugs are developed through extensive research, clinical trials, and regulatory approval processes. Surgical procedures: surgeons perform a variety of procedures to address conditions ranging from trauma and cancer to organ transplantation and cosmetic enhancements. Surgical interventions involve cutting, suturing, removing, or reshaping tissues and organs. Radiation therapy: radiation oncologists utilize targeted radiation to destroy cancer cells and shrink tumors. This treatment is commonly used in cancer management alongside surgery and chemotherapy. Physical therapy: physical therapists employ exercises, manual therapies, and other techniques to improve mobility, strength, and function, particularly for patients recovering from injuries or surgeries. Other interventions: allopathic medicine also includes interventions such as medical devices. Example: pacemakers, prosthetics, rehabilitative care, counseling, and lifestyle modifications for disease management. Prevention and health promotion. Vaccinations: immunizations are administered to prevent infectious diseases by stimulating the immune system to develop resistance to specific pathogens. Health screenings: regular screenings, such as mammograms, colonoscopies, and pap smears, help detect diseases. Example: cancer, cardiovascular conditions, at early stages when interventions can be most effective. Health education: allopathic medicine emphasizes patient education regarding healthy lifestyle practices, disease prevention, medication adherence, and self-care management. Public health measures: allopathic medicine plays a crucial role in public health initiatives, including disease surveillance, outbreak investigations, health policy development, and community interventions to control the spread of diseases. Interdisciplinary collaboration. Multidisciplinary teams: allopathic medicine often involves collaboration among various healthcare professionals, including physicians, nurses, pharmacists, physical therapists, radiologists, laboratory technicians, and others, to provide comprehensive care. Research and innovation: allopathic medicine is a dynamic field with ongoing research to advance medical knowledge, develop new treatments, and improve patient outcomes. This includes both basic science research and clinical trials. It is important to note that allopathic medicine is continuously evolving, with new discoveries, technologies, and treatment modalities emerging over time. Additionally, there is a growing recognition of the importance of a holistic approach to healthcare that considers not only the physical aspects of health but also the psychological, social, and emotional well-being of patients. How far allopathic is used in the world compared to other types of alternative medicines? Allopathic medicine, or conventional Western medicine, is the dominant system of healthcare practiced in most parts of the world. It is extensively used and forms the primary approach to medical care in many countries. However, the use of alternative medicines varies significantly across different regions and cultures. Here is an overview of the global usage and comparison between allopathic and alternative medicines. Allopathic medicine. Global dominance. Allopathic medicine is widely practiced and recognized as the mainstream medical system in most countries. It is the primary form of healthcare in many developed nations, including the United States, Canada, Western European countries, Australia, and others. Infrastructure and institutions. Allopathic medicine has well-established healthcare systems, hospitals, medical schools, research institutions, and regulatory bodies that oversee medical practice and drug approval processes. Education and regulation. Allopathic medicine requires extensive education and training, including medical school, residency programs, and licensure, to ensure competency and standardization in medical practice. It is subject to strict regulatory oversight and evidence-based guidelines. Alternative medicines. Regional variations. The prevalence and acceptance of alternative medicines vary widely across different countries and cultures. Some forms of alternative medicine have a long history and are deeply rooted in specific regions. Traditional medical systems. Traditional Chinese medicine, DCM, Ayurveda, traditional herbal medicine, and indigenous healing practices are examples of alternative medical systems that are still widely practiced in many parts of Asia, Africa, and Latin America. Complementary and integrative approaches. Many individuals also utilize alternative medicines as complementary or adjunct therapies alongside allopathic treatments. Practices such as acupuncture, homeopathy, naturopathy, chiropractic care, and herbal medicine are commonly sought for various health conditions in different regions. Regulatory variations, regulations and legal frameworks for alternative medicines vary significantly worldwide. In some countries, specific alternative practices are regulated, while in others, their regulation may be less stringent or vary on a regional or local level. It's important to note that the term alternative medicine encompasses a wide range of practices, and the efficacy and safety of these approaches can vary. While some alternative therapies have shown promise in certain conditions, others lack robust scientific evidence and may be considered controversial or unproven. Overall, while allopathic medicine remains the dominant form of healthcare globally, the utilization and acceptance of alternative medicines vary widely across different regions, cultures, and individual preferences. The integration and combination of different medical approaches, often referred to as integrative medicine, are gaining attention in many healthcare systems, aiming to provide comprehensive and patient-centered care. What are the alternative medicines available? Alternative medicine refers to a diverse range of medical practices and therapies that are used as alternatives or complements to conventional allopathic medicine. Here are some examples of alternative medicines. Traditional Chinese medicine, DCM. TCM includes practices such as acupuncture, herbal medicine, massage, tui na, cupping, and qigong. It is based on the concept of balancing yin and yang and promoting the flow of qi, energy, in the body. Ayurveda, originating from ancient India, Ayurveda emphasizes the balance between mind, body, and spirit. It utilizes herbal remedies, dietary modifications, yoga, meditation, and detoxification techniques to promote well-being and address various health conditions. Homeopathy. Homeopathy is based on the principle of like cures like. It involves using highly diluted substances derived from plants, minerals, or animals to stimulate the body's self-healing abilities. Homeopathy is individualized and aims to treat the whole person. Naturopathy. Naturopathic medicine focuses on supporting the body's natural healing processes. It combines various therapies, including herbal medicine, nutrition, lifestyle counseling, hydrotherapy, and physical manipulations. Chiropractic care. Chiropractors primarily focus on the diagnosis and treatment of musculoskeletal disorders, particularly those affecting the spine. They use manual adjustments and manipulations to restore proper alignment and function of the body. Herbal medicine. Herbal medicine involves the use of plants or plant extracts to promote healing and alleviate symptoms. Different herbs are used for their specific medicinal properties, such as anti-inflammatory, antimicrobial, or calming effects. Traditional indigenous medicine. Many indigenous cultures have their own traditional healing practices that are deeply rooted in their cultural beliefs and practices. These may involve the use of specific herbs, rituals, spiritual ceremonies, and traditional healing techniques. Mind-body therapies. These therapies recognize the connection between the mind and body and aim to promote health through psychological and emotional well-being. Examples include meditation, yoga, mindfulness-based stress reduction, MBSR, and biofeedback. Energy therapies. Energy-based approaches focus on manipulating the body's energy fields to restore balance and promote healing. Practices such as reiki, therapeutic touch, and qigong fall into this category. It's important to note that the effectiveness and safety of alternative medicines can vary. While some alternative therapies have shown promising results and have gained acceptance in certain conditions, others may lack scientific evidence or may be considered complementary rather than standalone treatments. It is advisable to consult with qualified practitioners and healthcare professionals before pursuing any alternative medicine approaches. Risk factors. What are the risk factors involved in opting for alternative medicines in comparison to allopathy? When considering alternative medicines in comparison to allopathic medicine, it's important to be aware of the potential risk factors associated with alternative therapies. Here are some considerations. Limited scientific evidence. Many alternative therapies have not undergone extensive scientific research or clinical trials to establish their safety, efficacy, and potential interactions with conventional medications. The lack of rigorous scientific evidence can make it difficult to assess their benefits and potential risks accurately. Delayed or ineffective treatment. Relying solely on alternative therapies, especially for serious or acute conditions, may result in delayed diagnosis or inadequate treatment. Some alternative therapies may not effectively address the underlying causes of diseases or provide sufficient treatment for certain medical conditions. Interactions with conventional treatments. Alternative therapies can potentially interact with prescription medications, leading to adverse effects or reduced efficacy. It's essential to inform healthcare providers about any alternative therapies you are using to avoid potential drug interactions. False claims and fraudulent practices. The alternative medicine market is not regulated uniformly worldwide, leading to a lack of oversight and potential for false claims or fraudulent practices. It is crucial to be cautious and seek reputable practitioners who have appropriate qualifications and adhere to ethical standards. Allergic reactions or side effects. Natural does not always mean safe. Herbal medicines and supplements used in alternative therapies can still cause allergic reactions, adverse effects, or interact with other medications. It is important to discuss the use of any alternative therapies with a healthcare professional to assess potential risks. Misdiagnosis or mismanagement. Alternative practitioners may not have the same diagnostic training or access to comprehensive medical testing as allopathic healthcare providers. Relying solely on alternative practitioners may result in misdiagnosis or inadequate management of certain medical conditions. Financial costs. Some alternative therapies can be expensive, and insurance coverage may be limited or non-existent. The financial burden of ongoing alternative treatments can be a consideration for individuals seeking such therapies. Postponing or rejecting evidence-based treatments. Choosing alternative therapies over scientifically proven and recommended treatments can have serious health consequences. It is important to discuss treatment options with healthcare professionals and make informed decisions based on reliable medical information. It's crucial to approach alternative medicines with a critical mindset, seeking information from reliable sources, and engaging in open communication with healthcare providers. Integrating alternative therapies should be done in a complementary manner, alongside evidence-based allopathic treatments, with the guidance of qualified healthcare professionals to ensure safety and optimal outcomes. Cancer and homeopathy. What would you say to a patient who visits doctor's office to tell that he has opted for a homeopathic treatment for cancer? The diagnosis of cancer is a devastating one, and patients will reach out for any hope they can find. It should be emphasized to the patient the benefits of conventional chemotherapy, radiation therapy and other treatments offered by physicians who specialize in oncology. Patients should be encouraged to discuss his proposed homeopathic treatment with his oncologists. If no hope is available from conventional medicine, they should be encouraged to live one day at a time. If the patient has faith that homeopathic remedy may help, acknowledge it and care for him as one would do to any other patient. What would one say to a patient who tells that she's taking medicines suggested by her herbalist in addition to the allopathic medicines prescribed to treat her diabetes, hypertension, osteoporosis and congestive heart failure? All herbs have pharmacologic properties just as do conventional pharmaceuticals. And there is the possibility of adverse interaction between herbs and any pharmaceutical, over-the-counter preparations or other type of prescribed product. Review each herb in detail and not take any herb that needed more time to review. Try to reach a joint decision with the patient regarding what would be safe for her to take. Most patients appreciate one's willingness to carefully review their herbal therapy. What would a doctor likely to say to a patient who's taking Coumadin for atrial fibrillation when he tells him that he wants to start taking ginkgo biloba to improve his memory? This combination of herbs and prescription drugs definitely falls into the unsafe category. Ginkgo biloba is thought to stimulate functioning nerve cells and protect nerve cells from pathologic influences. It also increases cerebral blood flow by inhibiting platelet activating factor. Thus, it will potentiate the effect of Coumadin and can lead to an increased risk of bleeding. The patient should know of the possible devastating outcome that may occur if he combines these drugs. If he chooses to use Ginkgo biloba, then should stop Coumadin therapy immediately and document the reason for it in the patient's record. However, most patients willingly follow their physician's advice if they appear to be well educated regarding CAM therapies. What are the conditions in which alternative medicines can be considered safely as an alternative or complementary to allopathy? Alternative medicines can be considered as alternatives or complementary approaches to allopathy in certain situations, particularly when used in conjunction with appropriate medical guidance. It's important to note that the effectiveness and safety of alternative therapies can vary, and individual circumstances should be taken into account. Here are some conditions in which alternative medicines may be considered. Chronic pain management. Alternative therapies such as acupuncture, chiropractic care, and massage therapy have shown promise in managing chronic pain conditions, such as back pain, osteoarthritis, and migraines. They can be used as adjuncts to conventional pain management strategies, helping reduce reliance on pain medications. Stress and mental health. Mind-body practices like meditation, yoga, mindfulness-based stress reduction, MBSR, and relaxation techniques can be beneficial for managing stress, anxiety, and mild to moderate depressive symptoms. They can be used alongside conventional treatments, such as therapy or medication, to support mental well-being. Supportive care in cancer treatment. Complementary therapies like acupuncture, meditation, and massage therapy can provide supportive care during cancer treatment. They may help alleviate treatment side effects, manage anxiety, improve quality of life, and promote overall well-being. It's important to integrate them into the comprehensive care plan under the guidance of healthcare providers. Lifestyle-related conditions, alternative approaches, including dietary changes, herbal remedies, and naturopathic interventions, may be considered in managing certain lifestyle-related conditions like obesity, diabetes, and cardiovascular diseases. These approaches can be used in conjunction with evidence-based medical recommendations, such as diet modifications and exercise programs. Palliative and end-of-life care. Alternative therapies, such as music therapy, aromatherapy, and relaxation techniques, can provide comfort and support in palliative and end-of-life care settings. They can help manage symptoms, promote relaxation, and enhance the emotional and spiritual well-being of patients. Preventive health and wellness. Some alternative practices, like Ayurveda, traditional Chinese medicine, and naturopathy, focus on preventive health and holistic well-being. They may offer recommendations for lifestyle modifications, dietary guidelines, and herbal supplements to promote overall health. However, it's important to consult with healthcare professionals and integrate these practices within a comprehensive preventive care plan. It's crucial to emphasize that alternative therapies should not replace evidence-based treatments in critical or acute medical conditions. It's advisable to consult with qualified healthcare professionals who can provide guidance on integrating alternative therapies appropriately and ensuring the overall safety and efficacy of the treatment plan. Open communication and collaboration between healthcare providers and patients are essential in making informed decisions about using alternative medicines alongside allopathic approaches.